I think I might have actually just accidentally gotten it there, but there we go. Hi, Craig.
Hey.
Thanks for coming in today. Craig is a new patient coming in with a complaint primarily focused on, I believe it was your left wrist.
Yes.
That's bothering you the most. So Craig is an avid climber and engineer. So as you can imagine, as a climber, he's quite dependent on that to do his hobby. And as an engineer, somebody who I imagine is doing a lot of working with their hands, you're going to need your wrist functioning for that as well, too. So in addition to that, he's got a couple of other things going on. We're going to let him talk about himself and kind of walk us through what he's dealing with. So Craig, why don't you go ahead?
Yeah, so I guess starting with the wrist, maybe a month and a half ago, I was playing hockey and I got bumped.
Okay.
And it was either in flexion or tension. And after that, it was no good. Now, anytime I put my hand flat on a table and if I was to do a push-up, for example, it's a lot of pain.
Not going to feel good.
And I've noticed that it's just plateaued there. So it's not getting any better. I also have sort of like a clunking collarbone, not exactly sure. Had a bad sleep the other night. I was sleeping on my left side, and when I woke up, like my trap and my collarbone, something felt off, and I'm still recovering from that.
Still feeling that now.
Yeah.
And that was maybe about a week ago then?
Yeah, that was about maybe a week and a half ago.
Okay, perfect. Okay, well, not perfect.
Yeah.
Quite
And
the opposite.
The last the sort of injury, I guess, I'd like you to take a look at is I was at a concert, jumping up and down in flip-flops, not wearing great footwear, and the outside of my right foot, it almost feels like there's something loose is the best way I can describe it.
Yeah. You guys can't see this on camera, but if we're going to do a foot exam, I'm going to make sure that you guys can see this afterwards. So you're saying on the outside of your right foot, what does it feel?
Just near your pinky toe, it almost feels maybe like there's something moving around in there. I can sort of feel it with my finger. I don't know if it's cartilage. I don't really know a lot about the...
That's okay. I will absolutely take a look at that. But your concern with that is what exactly? Like, you think you broke it? Do you think you dislocated it? Or does it just feel weird since?
It just feels weird since.
Okay.
Like, I don't know if... Sometimes, when I'm wearing dress shoes or shoes without a lot of support, I end up, I guess, putting some weight on the outside.
Okay.
And I pull something. And I'm in pain for the next day, and then it'll sort of go away, and I'll just feel around this toe again, this one thing moving around.
Well, I'll take a look at the feet for sure then as well. So we've got foot, we've kind of got like upper back, trap, neck region, and then the left wrist. So, now remind me, you mentioned that you had imaging taken of that left wrist, yes?
Yeah.
Both an X-ray and ultrasound, so what did they find?
So, I had an X-ray done, they didn't find anything on the report. And I also had an ultrasound done, and the report hasn't come through yet, but the early indications from the tech were that the tendons were looking
everything looked fine.
So
right?
Yeah, I'm sort of at a
weird impasse. Like, okay, well, something's not right.
Something's obviously not right, but nothing's showing up on imaging.
Okay, so very often I find that as a chiropractor, I'm getting patients who have gone like the traditional medical route for their complaints. In this case, it was getting imaging done, and they're unsatisfied with what they're getting. Now, very often we will get results that say everything looks normal, but clearly something isn't. And in this case, I'm guessing it's going to be pretty easy to see that, considering we've done this off camera, but we'll do it on camera for you guys, that there's a significant range of motion difference as well as a resisted range of motion difference when comparing his left wrist to his right wrist here. So there are several things that can show up, or excuse me, that will not show up on an X-ray or an ultrasound that are still diagnoses, and usually those are issues with movement themselves. You're not going to be able to see an issue with your joint kinematics or the way that you're moving if the image you're taking is stationary, right? Like if you're made to be still for an X-ray, which you have to, you're not going to see any issues with movement on that. Ultrasound, again, you got to be still. You're not seeing the tendons or anything during their activation. You're not going to see any movement issues with that. So right off the bat, I'm thinking that he's going to have some sort of joint sliding issue within the wrist, which guess what? Chiro is pretty damn good at addressing. That's my first indication. We'll get into that in a minute, though. We do need to do a physical exam, so we'll start with the back, the neck, then we'll get into the wrist and the feet. Do you have any questions before we get started?
No, I think I'm good. There's just one other issue I forgot to
course.
mention. Middle of my back here.
Okay.
I'm not sure if there's a vertebrae that's sort of been pinched or something like that. So I end up, when I'm on the dance floor, happens every now and then, doing a little bit of a limbo. And I've noticed now, I'm not sure if it's my old age, but there's something in here. And sort of, when I stretch out my back like this, there's that sort of middle of my back, that one vertebrae.
Does that feel good or like a pinching when you do
feels
that extension?
like a bit of a pinching.
Okay.
And so after some heavy days of, if I'm doing any lifting or stuff, and I start to feel that. I was wondering if you could just take a look there.
Of course,
sort of feel around, see how it...
So Craig is pointing to the TL junction region where his upper back becomes his lower back. You guys are very familiar with that by now. The TL junction absorbs a lot of shearing forces because our upper back and our lower back do two opposite directional movements. The structure in between, therefore, is responsible for absorbing those opposite directional movements, shearing forces. That's a very common site of a dysfunction or stiffness that people experience. So confident I'm going to be able to help you out with that today too. Okay?
Perfect. There we go. Awesome.
So it was your... Sorry, which side was it that you felt pinched on again?
Yeah,
the
it was on the left side.
It was on the left side. Perfect. Okay, so just going to feel through here. How's that right there?
Yeah, it feels a little tender.
A little tender. So first things first, I'm checking the upper cross musculature, also known as the upper trapezius fibers, and the levator scap on his left side, and we do have a little bit of tension there. I would anticipate if he's a side sleeper, which I know that he is because he told me, he would be also getting some tension in the side of his neck there, the scalenes, and I definitely feel like there's some hypertonicity there, but we'll examine that later. For now, let's just continue down the spine, and we've definitely got tension down this left side. Are you left or right-handed?
I'm left-handed.
You're left-handed. Interesting. Okay. There's some tension on the right too, but it's actually less. Now that's normal. We'll always see increased tension on the side of hand dominance. Well, not always, but like 90% of the time. So that's not too surprising, but it does help to understand what could be contributing to we're getting extra tension on this side. Let's continue down towards the TL junction. So you were kind of pointing to right around this region, or was it a little lower?
Just a little bit lower, right around there.
Okay. So yep, bang on. That would be his TL junction, right where the ribs end, right there. So that's firing on underneath my thumb right now. Let's continue down. Is there one side that's worse than the other, or is it really bang in the center?
Sort of bang at the center.
Bang in the center, okay. Okay, low back, the sacroiliac joint. Sacrum is the bottom of your spine. Your iliums are your hip bones here. Sacroiliac joint connects them. You okay if I feel through those two?
Yep.
Perfect. So, left side, a little bit of tension. Right side, tension as well. But honestly, actually, these don't feel that bad. So, good news. You're one of the first patients I've felt who doesn't feel like they have incredibly terrible SI joints.
Yeah,
no offense to all my other patients. I love you all dearly. Oh, a little incidental. More. Craig kind of released throughout the entire upper back, just unintentionally, but hey, we'll take that. Okay. As we know, Craig is dealing with left wrist issues. It's always good for him to compare to the unaffected side, though, just so we can see what his normal can be. So starting with his right wrist, we're going to bring that all the way into maximum flexion. And are we getting any pains within the wrist with this? No? Okay. We're going to do maximum extension. Any pains in the wrist with this?
Oh, that's fine.
Okay. Let's do some shearing forces through the joint space. So what I'm doing with this hand is pushing. What I'm doing with this hand is pulling. Any issue there? Nope. Okay, switching directions. Any issue there? We had a little click, but...
Yeah, it's just a click, but no...
Nothing there. Okay. Discomfort with this.
Nope, that's good.
Discomfort with that.
Yep, that's alright.
That's okay, good. And the last thing I'm going to do is actually try to push the joints together, and that's okay, yeah?
Feels fine.
Okay, good. Alright, so let's switch wrists here. We're going to go, this is the affected wrist, remember. Now, pain on maximal extension?
Yeah,
Okay.
Still got to go a bit further back. Yeah, right.
There we go. Okay.
Yeah.
So I'm applying a fair deal of force through his wrist here in order to achieve that. So it's not too bad, and it's only a maximum end range, but I can still understand how that's very frustrating if you're trying to hit a push-up or like a heavy bench, or if you're just trying to climb, right?
Yeah.
So let's go ahead and do this the other way. We're going to do wrist flexion in this case.
Yeah, that's starting to feel uncomfortable.
Right there as well? Okay. Now let's do the shearing once again. I'm going to shear like this. Nothing?
No.
Oh, okay. Pull you this way. How's that?
It's all right.
That's okay. And again this way. That's okay?
Yeah.
Okay. Now last thing is I'm going to jam the joints together and slide like that. How's that?
That's all right.
That's all right as well. Interesting. Okay. Still good?
If you kept going in this direction, I can feel it starting right there.
Okay.
Yeah. And I don't feel anything yet there.
Okay. So one thing worth noticing is that when I'm jamming the joints together, his maximal range of motion before the wrist starts to hurt is reduced. Okay, so that to me is telling me that it is in fact a joint kinematics issue. We're getting some sliding issues in the flexion and extension direction, which would be, and there's a lot of carpal bones here, but this would be along the luno-radio joint. Okay, this direction right here needs to be freed up. Now, as a general rule of thumb, as a chiropractor, when we find something that's not moving in a direction, our goal is to move it. Okay, so we're going to try to adjust through that wrist today, and hopefully we're seeing some improvement there, in addition to some acupuncture to the local area to try to bring in some blood and promote healing to the joint surfaces themselves. Any questions about that?
No?
Okay,
Good.
so that's okay. Craig was mentioning that he was spending some time on a dance floor or concert, excuse me, wearing flip-flops for whatever reason, and as a result he feels some strangeness kind of right here at the base of the 5th metatarsal. We'll throw up exactly what I'm talking about in the diagram just so that you guys know what I mean when I say that. Now, you're saying it was right here. This is the site that you're talking about, right? Yeah. Now, he did mention concern over fracture. While I'm very doubtful that it is a fracture because it doesn't exactly look like it has any asymmetry between the other side. How long ago did this happen?
This happened 3 months ago.
3 months ago. Okay, so it was a while ago. If it was a fracture, it would be well on its way to healing by now. But let's go ahead and rule it out anyways. This is a tuning fork, okay, 128, and 128. I can't read properly, and it's used to help detect latent fractures. And the reason it does that is because we start it vibrating, we put it over top the region where there's a suspected fracture. You know it's going to feel really bad if you do have a fracture? Little vibrations moving all of the jagged edges against each other. So let's go ahead and try that right now. Careful if you're using headphones here, you're probably going to hear a loud bang. There we go. And any pain with that, Craig?
No.
Nope? Okay.
Right.
How about there?
No.
And how about there?
No.
No? Perfect. Okay, so very unlikely that it's a fracture still. Maybe it was a fracture back in the day, but right now I think that's probably well on its way to healing. But you're saying that it still feels a little bit wonky, yeah?
Yeah.
All right, so let's go ahead and have a feel through. Compare that to the other side. Oh, look at that little release, just completely unintentional. Taking a look at the arches. Craig seems to have some pretty neutral arches, perhaps a teeny bit flat, but not anything to be overly alarmed about. And we've got some stiffness kind of in throughout the rear foot. Look at that. So that was actually just a release there that unfortunately I was talking through. It wasn't an intentional adjustment, but we definitely have compensatory restrictions within the rear foot. This foot you have no real complaints to mention for, yeah?
No.
Good. Okay. Have you ever used orthotics before?
When I was much younger.
What for? Or were you just kind of given
plantar fasciitis?
Plantar fasciitis when you were younger, really? So you were experiencing pain kind of like down through this region?
Yeah.
How's that doing for you now?
I haven't had any issues for several years.
Good, okay. Hopefully it stays that way. Okay. Okay. Actually, we're not done yet. I'll get you to any discomfort with that?
Nope.
Nope. Okay, relax. Any discomfort there?
Nope.
Nope. Okay. Any discomfort with this?
Nope.
Nope. And any discomfort with that?
No.
Nope. Okay. How about like so?
That's fine, yeah.
That's okay. And like so?
Yep, that's also fine.
Good. Like so?
Yep.
And like so.
That's all right.
Okay. We just did a gait analysis with Craig off camera because that's very difficult to film. It's hard to get down to the angle and see as he walks back and forth. But his gait is largely fine. He has a little bit, like I said before, a decreased arch, a little bit of a flat foot, but nothing to be overly concerned about. He's asymptomatic regarding it. Now, when I take his foot, and I actually end up, he comments that this complaint is the worst when he wears either dress shoes or hockey skates. Okay, both the dress shoes and hockey skates are kind of known for being, well, A, quite firm, and B, in some cases, quite narrow. So when I grab his foot like this and actually compress the front, what do you feel, Craig?
Yeah,
Hi, guys.
It feels a little bit like strange when you start doing that movement, I guess.
And then it calms down a bit afterwards, right? Yeah. Okay. So I'm trying to simulate what it would feel like to wear a dress shoe or a hockey skate. But then what he's going to do when he's wearing these shoes is that he's obviously going to be moving around. Okay, if you're wearing a dress shoe, you're at a wedding or something, you're going to be jumping around partying. If you're skating, obviously you're skating. Okay, that's easy enough. So my guess is that it's going to be another movement issue because otherwise it's not really able to be reproduced. And have you had any imaging taken for this yet?
I have not.
You have not. Okay, so the one way that we could kind of rule that in further would be to get things like ultrasounds and X-rays taken, but I don't think it'd be completely necessary. The best piece of advice I could give you is to find some wider dress shoes or wider skates, wear those next time you go out for dinner or whatever it is that you're going to do in a dress shoe and a skate, and see if that kind of relieves some of the pain. Another thing putting me down that line of thought is that Craig commented after he takes the skates off, he usually feels a loud recorrection or a loud pop or a snap or something, and that's probably everything trying to knock itself back into normal functioning orientation. So that's going to be another movement diagnosis for him down here. Any questions from that, Craig?
Nope.
No? Perfect. Okay. Craig commented earlier that he was having right shoulder discomfort or right collarbone popping. Now the upper back, the shoulder, and the neck are all very intimately connected biomechanically, which is to say when you have an issue with one, you usually get issues with the other. So yes, we'll address the shoulder today, absolutely. But we'll also be addressing the upper back and the neck, so let's get started with the neck. Any history of headaches, Craig? Did I ask you about that already?
No.
No? Okay, good. So Craig's got tension in his right side more than his left, but especially near the top or the upper vertebrae. Now he's still got some lower down too, but it's definitely more prominent up top. Okay. Let me get you to rotate your head as far as you can to the left for me, okay? Good. And then I want you to drop your head into my hand. That's really good. Oh, you're good. There you go. Nice and easy.
All right.
How was that?
That was good.
Good. Okay. And we'll do the left side as well. I'm just going to move the microphone.
Yeah.
You feel something there?
Yeah.
Yeah.
It's a little tight there.
Just a little. So guys, I'm doing the usual MRT that I do, the myofascial release technique, the pinning of the muscle, and ooh, yeah, stretching it underneath that pin.
Yeah, so this is the side I have challenges sleeping on sometimes.
Okay, is this the side that's spasmed up?
Yeah.
Oh.
I just didn't get a chance to...
Oh, my bad. I got the two mixed up. My mistake. So the left side is... So his right side did still feel quite tight, but he's claiming to have more tenderness on the left side, especially up at the top. So
I can definitely feel that.
there. Okay.
Yeah.
Well, it's been a long day. Apologies.
Oh, all right.
Okay. You should turn your head as far as you can to the right, please. Thank you. And drop the head. Good. That's the very top. Good. Once again, as far as you can to the right. I'm going to try lower down, okay? There we go. One more was hiding there. You know what, actually we're going to move the mic right over here. So Craig's saying that he's getting that left upper back stiffness, or excuse me, not stiffness, but that pain kind of in that trap region right through here. So let's go ahead. We already got a lot of release incidentally through this region, but let's see what we can get right here. So Craig, I'm going to ask you to take a big breath in and all the way out, all the way out. Good. Good. So we had another little release right there. And that's probably all we're going to get here now, but let's try up here. Breath in, and all the way out. One more. Good. Okay. We're going to be getting that TL junction on you next, okay? So what we're going to do for that is I'm going to pull this arm, pull, okay, all right? And I want you to put this hand in your armpit for me, okay? Good. Next up, I'm going to snake my arm through this. Bring this leg up. Bottom one straight, please. Good. Just like so. Scoot your hips a teeny bit closer to me. There you go. Perfect. All right. So what I need from you is I want you to practice pulling my arm up towards your head. Just practice it right now. Perfect. Okay, relax for me. Now when I say, I want you to do that movement. Okay, when I say, go ahead, do that movement. There we go. Perfect. So that was through the TL junction. Now we're going to do that to the other side. Right, left bunion. So same deal. I'm going to pull you this way just a little bit. Good. Hand at armpit. Bring this leg up. Scooch the hips towards me. Good. And then just relax yourself. So my hand's going to snake in through here. You're going to take a breath. Okay. And all the way out. All the way out. And pull my arm up. Good. Awesome job. So we're going to try to get into a wrist adjustment now with Craig. Now, full disclosure, I'm expecting this to be quite difficult given his history of it being very jammed up for a while. But still, it might take a few appointments before he can get some movement in there. Doesn't mean we're not going to try today. After this, we're going to be following up with some acupuncture. So first things first. Now, Craig, with your other hand, I'd actually like you to lightly grip the table over there, okay? Because what I'm going to be doing is distracting you like so, okay? And by distraction, I don't mean like telling a joke. I mean like pulling as hard as I can to try to splay the joints open from each other. So, splay, good. I think I might have actually just accidentally gotten it there, but... there we go. How does that feel?
Feels good. I mean, the test will be doing a push-up type.
So, I'm going to push you, okay? Is that okay?
I'm still starting to feel it right there.
Still there a little bit, huh? Okay. We got good movement through there, so I'm actually quite happy with that off the bat. Let me try over here as well. So this is going to be more towards the thumb aspects that you guys can see. Okay. Here's the other one. And then last, I'll try to splay out and open up the triangular fibrocartilage. I'll show the picture of that up there as well, just like this motion. So, okay. Is that okay?
That is not the most comfortable.
Not the most comfortable either. And you're feeling that still right here, right?
Yeah. Okay.
Let's follow it up with some acupuncture. We got good movement in there, and I'm happy with that. But clearly, we still got some pain modulation to deal with. All right. Good. Now, the unfortunate thing about these acu needles and acu around the wrist is that there is not a lot of space within the wrist. By that I mean we pretty much got skin and then we're on bone. But these are the acu needles that, there we go, that one went in a little deeper, that do conduct electricity, which is exactly what we want to do to try to help stimulate blood flow and healing to the targeted areas. So, There we go. That one went a little bit better too. And this one will be a little bit higher up, kind of right in there. Okay. So, current is going to come next, okay?
All right.
Okay, so, good. Alright, so we're going to turn it on very slowly, and what you should feel is a little bit of a gentle pulse through that region, okay? There we go. Good. And let me take the needles out. All right, Craig, so how did you find all of that today? It was quite a bit.
Yeah, it was. Definitely learned a lot, too, so thanks for walking through everything, explaining everything. Wrist is feeling very interesting right now. You got a good click in there, so that felt better. I think of just the acupuncture. I'm still feeling a little tingly from that. My neck feels, my back feels I feel a little bit straighter here.
Good.
I'm not feeling, what'd you call this?
The TL junction
the
there.
TL junction. Yeah, it's feeling a little bit better there.
Good. Okay.
So I feel a little bit lighter.
So this was Craig's first appointment of what's probably going to require at least a few treatments in there, especially when it comes to the wrist. He's been dealing with that for a while, so we can't expect to see an immediate resolution like that. That being said, I am very convinced that this is a kinematic or a movement issue, again, because he's had all the medical imaging outside of an MRI taken, and it's showing negative across all the boards, and movement in maximal end ranges of motion is the thing that provokes it the worst. So I would argue that if we were to keep correcting it, if we were to keep adjusting and keep moving it as much as possible, we're eventually going to see decreases in your pain levels and increases in your function levels. So I've advised him to try to return to the activity that he likes to do, including the climbing, the cycling, and what was the other one? It was yoga, right?
Yoga.
With as many modifications as need be. We try to keep our health good so that we can do the things that we want to do. The worst thing we can do when we get an injury is to just completely stop and write it off. So that's my advice to him. Any other questions for today? Or
I think you went through everything.
All right, awesome. Then I guess we'll just end on a high five, and we'll call that a day.
Perfect.
Thank you
Thanks
so
very
much,
much, Adam. Don't forget to like, comment, and subscribe.
Thank you so much, Craig.